Hi, this is Kenny, the co-founder of Aiskyra. We are pleased to introduce a new free tool we've developed for Ontario clinicians, such as doctors, pharmacists, nurse practitioners, and nurses. It's 100% free, no login required, no sign-up required, no premium version available. It is a unified search for Ontario Drug Benefit, or ODB, General Benefits drugs, drugs that require an LU code or an RFU code, or Exceptional Access Program, or EAP drugs and their criteria. This is the first time anyone successfully incorporated this drug data into a single unified searchable database. And we're offering it completely free of charge, no strings attached. Let me show you the difference between searching through Ontario's eFormulary website and Aiskyra's free web tool. I'll show you a general benefit drug, such as Ramipril. There's a huge list of Ramipril medications, and at the end, there's also Ramipril and hydrochlorothiazide combination pills. It can get a little bit messy. So on Aiskyra's web tool, just type in Ramipril at the top search bar. There are only two results: Ramipril by itself and Ramipril and hydrochlorothiazide. So we've already separated out these two to make it simpler to see. If you click Ramipril, you can see there's 59 DINs that are covered as a general benefit. It's the same information that you would have gotten from the ODB eFormulary website in a better user interface and searchability. If you want to check hydrochlorothiazide, you can filter out only those combo medications. So now let's look at a drug that might require an LU code. For example, I'll type in Ozempic. You can see the results show that there's 3 matches for Ozempic under the limited use criteria. So I'm going to click that. So you'll see there are 3 codes: 665, 666, 667. And you can click into any of them to view the exact LU criteria. So it'll list the clinical criteria, just like it would have listed it on the eFormulary website. It'll also include the duration of the LU authorization, and it will also include the DIN, which is exactly like how it would look like in the ODB eFormulary. The 3 different DINs for Ozempic: 667, 666, 665. Aiskyra's ODB web tool uses the exact same information that is publicly available on the eFormulary website. And it's updated when the eFormulary updates as well. So the cool thing about this search bar is that it can also do a reverse search. So if I actually type in 667 just as the LU code, it will match me with the drug that matches that LU code. Okay, lastly, I want to show you how EAP drugs can be easily searched. Anyone who submits EAP applications is familiar with this PDF that's available from the Ministry of Health, Ontario. And it is the EAP reimbursement criteria for frequently requested drugs. It's about 500 pages long, and you have to scroll through to find the right drug that you're looking for, to then read about the criteria. In our new unified search, you can quickly determine if a drug is a general benefit, a benefit with an LU code or RFU code, or something that requires an EAP. For example, everybody knows Zopiclone, also called Imovane, is not a general benefit. So if I type in Zopiclone, you can see there's only one matching result, which is under EAP. So if someone were to prescribe Zopiclone for an ODB patient, they would not be covered unless the prescriber submitted an EAP application. Anyone who's familiar with EAP is also familiar with this Excel spreadsheet, which includes 1,500 rows of drugs that are included in the EAP program, but don't necessarily have the criteria publicly listed. And Aiskyra's web tool incorporates this Excel spreadsheet as well. For example, a drug like meropenem is listed EAP drug, but its criteria for approval are not publicly listed. If I type in meropenem, you'll see there's only one match for EAP, and Aiskyra will tell you that approval criteria is not publicly documented for this drug. Prescribers must submit an EAP application. The one cool thing that Aiskyra's web tool can do, by combining all these different databases of formulary information, we can do a lot of reverse searching. So actually, I can actually type in something like asthma, and it will tell me all of the EAP drugs or limited use drugs that have the word asthma somewhere in its description or criteria. So for limited use, you can see that Symbicort requires an LU code for the treatment of asthma in patients. Now, what it doesn't do is it won't tell you all the general benefit drugs that could be used for asthma. If you would like Aiskyra to create therapeutic descriptions for all general benefit drugs, so that when you do type in asthma, you can find every single drug that could be used to treat asthma that is covered by ODB, let us know or send us an email. And that's it for this tutorial. As far as we know, this is the first tool of its kind. It looks best on desktop, but you can also access it through your mobile phone. We're always looking for ways to improve this tool for you. We're going to make it free forever with no login and no sign up. We just want you to use this tool to practice more efficiently and to the best of your ability.